Juvashev, Building Healthcare System. Almat Juvashev.
Thank you very much. Recently, we've been shocked by the gruesome news from the newsletters and the YouTube channels about the baby that was killed in a refrigerator in one of the western part of Kazakhstan. Actually, it's becoming as a trend. We see a lot of nasty stuff and nasty news around the Kazakhstan about some mistake that committed by our physicians, doctors. The patient died from the allergy, and etc. And everyone seems to blame the Ministry of Health, the minister himself, for those problems, as if if we change them, everything will change. Not exactly. There are some fundamental issues that's happening in our healthcare that should be addressed as soon as possible. I'm an acting director of the Strategic Department of Republican Center for Health Development. And I was leading the task force to create the new healthcare program for 2025 to address those issues and to actually transform our healthcare system to the way that is going to be sustainable, that will improve the quality of care and access to care. Ladies and gentlemen, Madame Kosmate, today you are going to learn some brief information about our healthcare program, major points, and I'm going to briefly touch why we actually took that path. But before going on, I would like to tell that our health is determined by different factors: socio-economic conditions, environment, your own behavior, like if you are drinking alcohol, smoking cigarettes. I'm not going to touch them today. I'm only going to touch the smaller part of the health, which is related to healthcare facilities and the healthcare itself, like a Ministry of Health. So let's start from the number one issue that we should address, which is the lack of resources. You might be wondering, what's the lack of resources? By the standards of the World Health Organization, they actually recommended all the countries to spend at least 5% of their GDP on healthcare to make it sustainable. It was in early 2000s. If you check the data from World Bank for 2016, the world average was 10%. That's the average. If you check the countries who are epitome for the good healthcare, they actually spend 11 or more percent for the healthcare, like Germany, France, US, 17% of GDP goes to healthcare. Our neighbors, Russia, spend 6%. Uzbekistan, around 6% of the GDP goes to healthcare. And now compared to Kazakhstan, we have only 3.5% in 2016, which is not sustainable. Why? Because if more money spent in the hospitals, in the physicians, will give us better access to new services, improve the quality of care. Like for you, instance. If you have more choices, you perhaps will be less cut the disease and have more prophylactic services available for you if you can expand the services. And what we did from the next year, what we are going to do from next year, is going to establish new payer, social insurance payer. And all the employers, the companies, employees are going to contribute to the system. And by doing so, we at least can provide some sources of expenditure to the healthcare. And we are planning to increase this like from 3.5% to 5% by 2025. What it means for the ordinary customers. Primary healthcare, which is considered to be the most important part of the healthcare system, will be completely free for every one of us. The drugs, the medicine, will be free of charge for the children up until 18 years old. You don't have to think about where to get those prescription drugs for your children. Everything will be covered under this social insurance scheme. The prescribed drugs will also be discounted for you. You will have heavy discounts in the pharmacy. You will have access to more prophylactic care. The screening of the diseases will be widened because of introduction of new social insurance fund starting from next year. This will improve the access to the care. But how about the efficiency? Our country is notoriously bad on making the healthcare efficient. I'm going to explain why. First, the same organization, World Health Organization, conducted this study in Kazakhstan in 2014, where they found out that we have a lot of patients who go to inpatient care into the hospitals where they need a lot of technology. There are a lot of specialists treating those patients. They do not need those inpatient care. They do not have to be there. It can be treated in an outpatient care, in the family practice, so-called, where there's a physician, therapist can look after them. And it's more and more prevalent in the countries outside of Kazakhstan. In our case, almost 30% of the cases could be treated in this outpatient care. Instead, they go to inpatient. And I'm going to provide you with examples. We went to rural areas recently, visited at least 10 districts. And there one large hospital, district hospital, runs everything, from inpatient to outpatient. They're monopolizing the system itself. And when it comes to the decision making, they usually decide for the inpatient because the government reimburses those hospitals more lucrative money. They provide lucrative money to the hospitals. And that's why they decide to put the patient into inpatient care rather than treating in daycare. What we're going to do is designing a completely different system. From 2021, we are going to introduce family doctors. Who's a family doctor? The family doctor is a person who can treat you as an ordinary therapist, but his skills will be expanded. He can treat the children. He can treat the elderly people. He can actually perform some operations, the surgery, like suturing the wounds. He can make the eye examination, nose, ears. So instead of going to 6 to 7 different specialists, you can go to one person, and he will treat you and your family within the single place. And returning back to this district hospitals, once we introduce this family practice, we can divide this outpatient and patient from each other. The outpatient care run by these family practices, they can take up to 80% of cases there. And only those patients who really need the inpatient, who really needs a lot of resources to treat their diseases, they can be referred to these hospitals. That's what efficiency means. The person needs to be treated exactly where he must be treated. So this is redesigning the system itself. We are going to open the family practices, and the primary care itself will be the major point of our program until 2025. Okay, we almost solved this access to care and improve the efficiency, at least on paper. But how about the quality of care? Who knows the definition of the quality? Who can give us what is the quality of care? Do you have any ideas? Of any kind of system. If, for you as a customer, when it meets your expectations, yes, expectations, meets some definite standards, like the protocols in our case in a healthcare setting. So, in terms of the quality, the main focus will be on doctors, physicians. Since we have more money poured into the healthcare system from the health insurance fund, we can start paying more wages to our physicians. And I can argue that that's one of the main points we should focus on. And I'll explain you why. First, let's see what the official statistics tell us. According to official statistics, our physicians receive 145,000 tenges on average a month in 2018, compared to the average salary of 160,000. It's even lower than average. Let's check our neighbors. In Russia, the physician received the wages on average for 500,000 tenges. It's almost 3 times higher than us. Turkey, which has a comparable size of GDP per capita, if you are just newly graduated student from the medical university and you're going to be employed by the hospital, you will receive $2,000 just as a starting point, or roughly 800,000 tenges. So I argue that we need to increase this, the salary of our physician few times. In our case, we are planning to increase it from 140,000 till almost 900,000 tenges by 2025. Please forgive me my mistake, 700. In any case, it's large enough money to sustain the doctors. And why we need to increase it? You can ask why we need to do so. They already are not efficient, they do not provide the quality of care. Why we should support those doctors? Well, first, it's all about the talent. The talented youth, they usually prefer to go to the lucrative field. As they see that the doctors, even though that profession is a noble one, they're paid less and there are too much expectation, they skip over it. Yeah, they go to oil industry, IT industry, but not into the healthcare. So we are going to be devoid of professional, smart, young people who skip this field. The second is current doctors. They need to take 2 or 3 jobs, more night shifts, in order to support their family. Less time left for their self-development and improving their skills as a physicians, which corresponds with the level of quality. If they are stressed out and suffering from burnout, you cannot expect the quality from that person. And the third, the physician who's already in the field, they are leaving this field right now. They live into the different lucrative part of their business, like the pharmaceuticals. Or they leave the country itself. Like when we visited one of the villages in Karagarda region, it was the village of 1,000 people, and they had one doctor treating the entire community. She was treating that community for 20 years or so. And she told us in the pep talk that followed that she received an offer from Russia. It was lucrative enough for her to actually change her mind and go there in search of the job to become a physician. And so this village will stay without a physician for the rest of the time. And that's not only the story of one village. There are many more villages across the Kazakhstan who has a shortage of the medical professionals. In order to solve this problem, we need to invest into the profession. We need to increase their wages to keep the talent. By increasing the wages, we also have to increase their responsibility. So in the healthcare program, we also increase their requirements for the physicians to practice. We put new regulations on that called licensing. If the person is licensed as a doctor, he has a personal liability for the health condition of his patient, which means if he conducts misdeed, negligence, his license will be removed and he cannot practice anymore. So, ladies and gentlemen, I just briefly touched these three areas where we can improve in our healthcare. By following those initiatives, we can improve the access to care, more free care for everyone, better quality, and better efficiency. And it will be felt by everyone, us as the customers, our families, and everyone in our community. And I would like to conclude my speech by a famous quote of the Albert Einstein, who said, "We cannot solve the problems with the same thinking that created them." So we need to create new initiatives to improve the healthcare, and do not place the blame on only individuals who's running this care, because there is fundamental changes need to be done. Thank you very much. Now we are switching to Q&A session. Thank you. If you have questions on any questions related to this presentation, please do not hesitate. I can answer your questions. Yeah, gentleman over here.
My name is Mohammed, and my question is, do you really want to, salary of a physician will be 700,000 till 2015, 2025?
How we come up with the number? You mean, yeah, or do one plot?
No,
Can you-
are you sure it's really
Achievable.
achievable? Yeah. Because I don't think it's
Okay.
700,000.
Well, actually, we are not only. Thank you very much. It's exactly a good question in terms of how we come up with the number, and are we sure that we will reach this mark? Well, first of all, related to inflation, yes, we accounted for inflation, and when we put this indicator, it's called the salary, the average salary for the physician compared to the average of the rest of economy. And we put the number 2.5, which corresponds to 700,000. No matter what the inflation rate, the salary will adjust to the inflation. The second, how we are going to fund this? Well, first of all, people overestimate the number of physicians we have. We only have 15,000 physicians across the country, roughly 55,000. It's first, it's not a large number. The second is that we also have the social insurance fund that we're going to pour the money into the economy. So I guess we can find the ways to increase the wages. I guess we are running out of time. How much we have?
You don't have it.
20 minutes. I'm sorry. It was only
30 seconds.
20 seconds?
I
Just, I don't remember the
Ask
yellow
more
charts.
Do we have
I just, I have some
Turn
yellow
down.
and green cards, so just only red one. I'm
20
s-
seconds left.
Okay, one more question, please.
Actually, I got another question, but the place to summarize your speech. So you said there are three measures to improve our healthcare system. And the first is to introduce family doctors. The second, increase salaries of the physicians, of the doctors. And the third one, just because of long speech, I've lost this.
I'm sorry.
Point.
So the three of them. Yep.
Yeah, you said three.
Family
measures.
practice, a health insurance fund, and increase the wage for a physician. That were three main points, but we have much more in this health care program. We have 9 direction initiatives, but I only briefly touched 3 of them. That, in my opinion, can have a huge, dramatic impact on the healthcare. But thank you very much for this question. I guess that's all. Thank you very much.